Hello and good afternoon, friends. Welcome to the CEC-UGC live lecture. Dear friends, with our special series on cancer, so far we have conducted numerous sessions, and through these sessions we have tried to understand about various kind of cancers. Dear friends, the objective of carrying such type of series and carrying such type of lectures is to make you aware with this particular type of disease, to make you aware that this type of disease, that is cancer, can exist in the various parts of the body. So we want to aware you, we want you to take care of yourselves. So therefore, we conduct such type of sessions for you. Dear friends, in this session today, we are going to talk on colorectal cancers. What are colorectal cancers? For your knowledge, I would like to tell you all these are the cancers of large intestine. Have you ever thought of that cancers could exist in large intestine also? Dear friends, yes. For this discussion today, we have with us in our studios Dr. Majid Ahmmed Talikoti, and I would like to tell you all that he is senior surgical oncologist, and he is working with one of the leading hospitals in Delhi, as well as he keeps on visiting different hospitals, as well as he conduct various seminars, workshops, so that you people are aware that how dangerous cancers are, but this disease can be cured if you take care of yourself and visit doctor frequently. So without wasting any time, I would like to welcome our guest, Dr. Majid Ahmed Talikoti, and let's under his able guidance try to understand about colorectal cancers, that is the cancers of large intestine. So first of all, I would like to welcome our guest. Hello sir, welcome to the EduSec lecture.
Hello, good afternoon.
Yes, sir. So through you, we want to understand about specifically this type of cancer, as the name suggests, colorectal cancers, though it is beyond the understanding of the common people. But as you yourself have told me in advance that these are the cancers of large intestine. So kindly explain us in detail what kind of cancers are these?
Basically, colorectal cancers, these are very common cancers. If you just see like how common they are normally, third commonest cancers. Like in males, you get the in males you get the lung cancer, oral cancer, which are more common than these, and in females you get the breast cancer and the cervix cancer. But this colorectal cancer is very common in both, in males as well as females, and it is the third commonest cancer. And if you see the mortality wise, people dying from this cancer, it is the second most commonest cancer. A disease where the disease of cancer affects the intestine. We all have small intestine, large intestine. If you see this slide, here what you see in orange is the large intestine in our body, in the stomach, and if the cancer occurs in this large intestine, then it is called as a colorectal cancer. Very famous personalities, since this cancer is common in any family, it can occur. So we have seen very high profile people also developing this cancer. If you see worldwide, you might have heard about Bobby Moray, who was the captain of the England cricket team which won the 1966 World Cup. He was one of the greatest players of all time. He suffered and died from this cancer. Corazon Aquino, she was the first female president in Asia and the 11th president of the Philippines country. And she was the icon of Philippine democracy. She also suffered. Who has not heard about Queen Elizabeth? She was the mother of Queen Elizabeth II and wife of King George, who also died from this colorectal cancer. And we see these days a lot of cancer survivors because of the knowledge, the awareness, the treatment. Usually colorectal cancers, they contribute about 10% of all the cancers. We have more than 200 varieties of cancer, and out of that, colorectal cancer contributes 10%. It is the second most common cancer in the females and third most common among the males. And mortality wise, I have already told you that it forms the second commonest cause of death. In India, if you see which cancer is common, the red one indicates the cancer which is in females and the blue one indicates the cancer which is in males. If you see the breast cancer, it's commonest among females, nearly 100% in females and very rarely in males. Cervical cancer you see here. And similarly, if you see colorectal cancer is equally common among both. If you see, as per the recent 2014 estimates, the colon cancers in India would be nearly around 96,830 patients and the rectal cancers would be around 40,000 per year. And nearly 50,000 people are dying from this cancer in India. Death rates are declining these days because of the better screening. Screening is a program to identify the disease before you really have the cancer. And the better treatment what we have today, the advancement in cancer care, the screening leads to early detection, screening leads to awareness, and once the person identifies or gets screened and the disease is diagnosed early, the results are really good. The patient, though having cancer, is equal to not having cancer after the treatment because of the early diagnosis and treatment. And this has led to decrease in the incidence and deaths of the colorectal cancers. What age group is this cancer common? The peak incidence is seen at the age of 60 to 70 years of age, and less than 20% of the patients are diagnosed with less than 50 years of age. These 20% are those patients who have familial disease, like in whose family the disease has been common, where there is genetic correlation. In those patients, you will get the disease in less than 50 years of age, or normally it is at the age of more than 50 years, that is around 60 to 70 years, people are diagnosed with colorectal cancer. Adenomas are the precursor lesions, are the pre-malignant lesions. Males are 20% more often affected than the females. If you see the worldwide distribution, it is seen commonly in nearly any country, and highest rates are seen in US, Canada, Australia, New Zealand, Denmark, Sweden, and also in India. Here you can see the colorectum usually consists of the appendix, cecum, ascending colon, transverse colon, descending colon, rectum, and the anal canal. And if you see, it is the sigmoid colon where you get the 20% of the colorectal cancers, and the rectum, which constitutes 38% of the colorectal cancers. That means nearly 60% of the disease is in the distal colorectal area, in the anal canal region, the rectum and the sigmoid colon, and rest it is a little bit less, like in the cecum 8%, hepatic flexure 8%, ascending colon 3%, transverse colon around 6%. The most common burden is near the sigmoid, rectum and the anal canal. There are very high risk factors. And what are the high risk factors? Who are the individuals? Who are the persons who are at the risk of developing colorectal cancers? Familial adenomatous polyposis. It is a condition which runs in families where they have multiple polyps in the rectum. Hereditary non-polyposis colon cancer. In families where the rectal cancer is common, those who have suffered either before from the colorectal cancer or the ovarian cancer, the endometrial cancer or the breast cancer, those individuals who are getting above the age of 50 years, they can develop the colorectal cancers. Those individuals who are having disturbed bowel, those individuals who are having like the Crohn's disease or the ulcerative colitis, whom we call as an inflammatory bowel disease, these individuals in the later course, they can develop the colorectal cancer. And see what usually happens, the diet goes through the esophagus, stomach, small intestine and the colon and the rectum. So the colon rectum, where the food passes, where it is absorbed and where the material, unwanted material will be excreted, stored, that is the area where we are discussing that the colon cancer can occur. That is in the colon. Why? Because there the residual things which are in contact with the mucosa of the colon, there the mucosa gets the change. So diet, which has to go from there, the path where absorption, excretion takes place, where storage takes place. So any food that will take a longer journey or does not get absorbed easily, or that food which will remain in contact for a longer time, that can lead to cancer. So what is that diet? We'll be discussing. Usually the fat, red meat and decreased fiber is an important. So diet is very important. If you have a healthy diet, then your risk is less. If your diet contains more of fat, if your diet contains more of meat, if your diet contains more of things, decreased fibers and all, then you are at a risk. So need to take a good healthy diet. Smoking. See, smoking is also responsible for colon cancers, and we have discussed in previous lectures in detail about the smoking, the disadvantages, and we very well know that 50% of all cancers are because of smoking, and colon cancer is also because of smoking. And in females also, nearly 25% of cancers are because of smoking. So be aware, do not smoke, do not kill yourself, do not commit suicide by taking tobacco in any form. Diabetes mellitus, HIV. People who are suffering from HIV, they can also, develop colon cancer. Radiation therapy may be for any other cancer like the prostate cancer, and the rectum is located behind. So if radiation is given, maybe after many years, there is a chance that you may also develop a prostate cancer, means you may develop the second cancer in them as a colon cancer. But nowadays the radiation has become very safe because of the newer inventions, newer techniques, and because of the true beam and all that. Among the other risk factors, I told you polyps. What are these polyps? I'll show you a photo of polyps also later. It is normally a non-cancerous or a precancerous growth. And these polyps, during due course, they convert themselves into a malignant and they form the colon cancer. Obesity, putting on weight, And that is also directly, indirectly related to your diet and related to your lifestyle. So be aware, don't be obese. And obesity, you have seen, it also causes breast cancer and many more cancers. So exercise yourself so that you lose weight and you are not obese and you don't have a risk for colon cancer and other cancers. So now, I told you about the dietary factor. Yes, I just want to tell a few words like you have an increased risk for colorectal cancer if you consume more of red meat. Red meat like beef, etc. So if you consume more, then you are susceptible, you are at a risk of developing colon cancer. Especially the animal and saturated fats. So avoid a lot of fatty food. So fat can be, cheese and, excess of fat, whether it is vegetarian fat or it is an animal fat. Any fat can be one of the reasons for you to develop the cancer, especially the colon cancer. And don't take too much of sweets, carbohydrates, and alcohol. See, alcohol, tobacco, day in and day out, we all know the hazards of it. The hazards not only related to cancers but also to ill health. But still we continue to consume, still we continue to, kill ourselves. So beware. You should also know that alcohol can also cause colon cancer. And what can decrease the risk? Which is the diet I should take? Because without eating food, I cannot live. And if I have to live, I have to take diet. Should I quit? No. Have limitations. You should take food that is like, which is more of vegetables, more of fibers, which can be easily digested, which will not add calories, which will not add more of, overweight. So, you see here, we had discussed about the oral cancers where, lung cancers where tobacco. And after that, tobacco, alcohol. Now, you see, diet is also one of the risk factors. So, you need to modernize, you need to have the dietary habits what our great grandfathers and all they had. That is fresh fruits, fresh vegetables, limited meat, no alcohol, no tobacco, and more of the antioxidants, vitamins, calcium. That will help you to decrease the risk of colorectal cancer. So we were discussing now like familial adenomatous polyposis. What is this condition? This is a condition, where there's genes, mutations in your body, where it runs in families. There is 100% risk of an individual suffering from familial adenomatous polyposis, having multiple polyps in the colon, which can be easily picked up by colonoscopy or a sigmoidoscopy on screening. And if you have and you are diagnosed with familial adenomatous polyposis, then you should undergo a prophylactic surgery, prophylactic removal of the colon. And why? Because by the end of 50 years, you will 100% develop colon cancer. So you should screen yourself for this. Similarly, hereditary non-polyposis colon cancer, this has around 70% risk. So, see, there are certain things which we cannot modify. We call them as non-modifiable. Like, I'm growing, my age is growing, and I'm going to be 50. So maybe at 50, I may develop a cancer. Then my personal history or my family history. Like if my father had a colon cancer, I cannot change my father or mother. But since that disease was running in my family, I can be a bit watchful. I can screen myself. Note, not 100% of that will happen. I will show you by a graph or by number of percentage how much is the risk if it runs in families. We all know around 5% of cancers are familial. That means 5% of cancer, there is a risk that if it runs in my families, I can also develop cancer. So, but there are certain factors for which I can do something. What are those? Those are, for example, my diet. Yes, I can change a diet, I can have a healthy diet, I can take good fruits, vegetables, I can exercise myself, I can, maintain a healthy, fit life. I can decrease my weight, decrease obesity, I can avoid smoking, tobacco, I can avoid alcohol. So these modifiable factors which contribute the maximum percentage for developing a cancer, I need to modify. These are known as modifiable factors, and I have named you which are those, like the diet, physical activity, obesity, smoking, alcohol. So we need to have a control over all these factors. So if you have, who are those people who are at risk on the non-modifiable risk factors? If you have a history of, polyps, if you have someone in your family who is suffering from this disease, or if you have, who is suffering from bowel disturbances, normally we call them as inflammatory bowel disease, like ulcerative colitis or a Crohn's disease. These are, non-modifiable. These cannot be changed, and some are modifiable, as we discussed. So now, 1 in 5 patients may have this familial history, and these are the ones, especially the first degree relatives like my brothers, my sisters, my father, my mother, and second degree relatives like my uncle's children. So first degree relatives are at higher risk if in the family the cancer is running. So see, always we are discussing in this colon cancer, diet. So beware of the red meat, processed meat. You can take more of fruits, vegetables, grilled cooking, or fish. Like these are a little bit less risky. You can take this, you can consume this, but you need to consume within the limits. I told you, what we can modify, what we can do is we can stay fit, we can stay healthy, we can reduce our weight. How? We can exercise ourselves. Let's walk. Let's, do some amount of exercise. Let's spare some time for ourselves. This will definitely go a long way. Not necessary. Even if you start it a little later, elderly people also, if they start even from today, that is going to benefit them. Don't put on the extra more weight now. Try to either stay there and try to reduce yourself to be away from the cancers, to be away from other diseases. Actually, I was just, the other day I was reading a joke on diet, What it was said was, like, what we eat, 1/3 is for ourselves, and the remaining 2/3 is for the doctors. I hope you got my joke. That means if you eat more, that you are becoming, you are making yourself ready to spend on doctors. So avoid overweight and obesity. Quit smoking, quit alcohol, I always say, and I say today also, quit tobacco, quit alcohol, you will be away from major diseases, major cancers. And there are other risk factors. Like I told you, if you have undergone radiation treatment for some cancer, so there is a chance that, you may develop a second cancer when you're a cancer survivor for more than 15 or 20 years. And nowadays you see there's a trend of working hard. Those who do more night shifts, maybe 3 night shifts a month for more than 15 years. So your health is going to deteriorate, and that can add on, that there are studies which have shown that yes, they can develop cancers. And take fruits, vegetables which contains more of vitamins. So just diagrammatically, take calcium, fibers, fruits, vegetables, drugs. Your risk will, drugs like multivitamins and all that. So that is going to reduce your risk. If you take these factors, those are at different risk are, like, if you have a familial history, if you are having inflammatory bowel diseases where your bowel is not good, not strong, if you have a family history. So I told you polyps. Initially I showed you a slide where a polyp is a precancerous lesion and is going to turn into cancer. Now if you come to know you have a polyp in your bowel, and the size of the bowel will decide, like bowel, if in the bowel, if you have a small polyp of less than 1 centimeter, your risk is a little less. Maybe if you have, it will be somewhere, the risk will be around 10%. If you have a polyp which is around 1 to 2 centimeters, then your risk varies from 30 to 50%. And if you have a polyp, if you have a polyp, more than 2 centimeters, then your risk is going to be from 30 to 50%. That means your polyp changing into cancer is nearly like, out of 2, 1 will develop a cancer. So whenever there are polyps, you can better get them removed by colonoscopy and get it, histopathological study done. And if in the study it comes like it's benign, nothing more to be done, that means it is better before that polyp turns into an ulcer, get yourself treated. And if there is a polyp, if it is less than 1 centimeter, keep a good watch, like repeated screening every 3 months to see that polyp does not increase in size. And if it is more than 2 centimeters or 1 to 2 centimeters, better get it removed. So I was telling you familial risk. See, if any one of my family member is having a cancer, and I told you that yes, there is a risk that I may also develop cancer, how much is the risk? If none of the family member is developing or has a cancer, then it's just 2% that I may develop a colorectal cancer. But one of my family members, first degree relative, is having cancer, then there's 6% risk. If one of my first degree relative and one of my second degree relative is having, then it is around 1 to 8%. And if anyone in my family, or if I am having HNPCC, hereditary non-polyposis colorectal cancer, then there's 70% risk that I may develop a cancer. And if I am having a familial adenomatous polyposis where there are multiple polyps in the colon, then by the age of 50 years, there is 100% chance that I will develop a colon cancer. Those individuals, depending on the risk, need to treat yourself. Either maintain on a screening or go for a prophylactic surgery in case of FAP, familial adenomatous polyposis, where there are multiple polyps in the colon, because the risk of you developing cancer by the age of 50 years is 100%. Now, see, whenever any disease comes, like cold, you have a symptom of, sneezing and all. In colorectal cancer, what are the symptoms? Mind it, in any cancer, whenever the symptoms come, and you are think that the disease is in a later stage. Now the symptoms are because the disease is in the bowel. What are the symptoms you can have? The bowel can get blocked, so you may have an obstruction. Because of that, you may have vomiting, or what may happen because of the narrowing of your passage of the colon because of the cancer, you may sometimes pass good stools, sometimes you may pass loose stools, sometimes you may pass hard stools. That means you will have altered bowel habits, like sometimes constipation, sometimes diarrhea. If this type of symptom is there, this could be because of the colorectal cancer. And if it is continuing over months and years, then better get yourself screened for it. Other than that, if a male has anemia, unless proved otherwise, especially after 50 years of age, we should go in the direction, think in the direction that probably, yes, this male could have a colon cancer. In females, there are other causes like, bleeding, menstruation and all those things that where you can get a anemia. Pain. Whenever there is a growth in the colon, you will get pain, but that will be in a later stage. So, the symptoms also vary based on, which part of the colon the cancer is. If it is in the, proximal colon on the right side, so you will have more of a, mass palpable, pain, and bleeding will be more, when it is in the peripheral, that is in the rectum and the anal canal. So normally what symptoms we have is pain, mass, rectal bleeding, altered bowel habits like sometimes constipation, sometimes diarrhea. Yes, when you are bleeding and because of the obstruction you are not eating, you are bound to lose weight. So loss of weight, loss of appetite is a general symptom of a cancer. So what happening is, whenever you have colon cancer and you are getting the symptoms, no need to panic. You need to, get yourself screened, and once you are screened, you come to know, yes, there is a polyp, it can be treated well. And even in colon cancers, the prognoses are really good. We go ahead, I will tell you, I will show you, how good the disease is, meaning to say if in early stages nearly there is 100% chance of cure. Unless and until this is advanced, last stage, even in last stage, 10% of the people live for more than 5 years. So if you get yourself treated, maybe you are one among those 10%. And what were the risk factors? These are the etiological factors. These are the causes of the cancer. And I told you what is going to benefit, what is going to harm you, which diet is going to benefit, which diet is going to harm you, where obesity is going to harm you, where your habits, personal habits are going to harm you. These all form the etiological factors. 50 to 70% cause for colon cancer is your diet, and 35% of all cancers, diet is the cause. If you see the colorectal cancer etiology, your personal lifestyle, your environmental exposure, your lifestyle, colorectal cancer, they all go on and on. They are like a cycle. If you see, what usually happens is you have the normal epithelium. When you take diet, the diet, when it causes a diet which is not good for your health or a genetic, then it causes a gene mutation. Then you get the early adenoma, then the adenoma gets a polyp, the polyp, slowly and later it gets changed into a carcinoma, and then the cancer spread and metastasis, then it goes to your bones, lungs, brain and other parts, and then ultimately, you land up with cancer. So what are the questions you should ask to yourself? Whether I am at risk, and try to, do I have a polyp? Whether I am suffering from bowel disturbances like altered bowel habits, or I am having any of the symptoms related to bowel, or any member of my family has suffered from cancer. If the answer is yes, then I am at risk. If the answer is no, my risk is less. So you can start screening after the age of 50, and if you are at risk, you should start immediately the screening. If you ask, can I develop colorectal cancer being a doctor? Yes, anyone can develop. And what age normally? Yes, the age is after 50 years. And nearly 90% of them, they are diagnosed after the age of 50 years. So we are discussing, usually, see, the colon is like a tube. You have a small tumor, it will never give you symptoms because there is a lot of space for the food to go by the side from the passage. So by the time you develop the symptoms, it's nearly late. So don't wait for the symptoms to come and then go for the treatment. And don't neglect any symptom which you think could be, could be cause for the cancer. Like for in general, if you see the symptoms like, usually there are certain symptoms which we should not neglect. For example, if there is an ulcer anywhere in the body which is not healing within 15 days, if there is a lump or a mass anywhere in the body, you should not neglect those symptoms also. If you have difficulty in eating, if there is a change in voice, there is indigestion, loss of weight, loss of appetite, if there is a bleeding through any passage, whether through the nose, through the mouth, or any passage from where bleeding should not occur, and if you're having cough which should not occur and it is there, and if you are having abdominal distension, you are having indigestion, you are having vomiting, you are having jaundice, you are passing blood in the urine, or you are feeling a mass in the abdomen, or you are having any altered bowel habits like sometimes constipation, sometimes, these are the general symptoms which are most commonly a person should not have these symptoms for more than 5 to 10 days. If they have it, then you should give an alert and an alarm to yourself, is there something going wrong in my body? Now, think, a person is having some symptoms, what I said, is at a risk. Now, how will I come to know whether am I suffering from colon cancer or no? So, what we normally do is, since we know that this cancer is in the colon, that is in the large bowel. So, that what you need to do is, how can we see inside? We have a scope. I will show you how the scope looks like in one of this. Through that, you go through the rectum, through the sigmoid, the ascending, transverse, descending, and then you just see, is the lumen okay? That we call as that procedure as colonoscopy. We put a scope and go, this is a painless procedure. Sometimes it is done under MAC. Don't need to give a general anesthesia. You are given some laxatives to make the bowel free from the fecal matter. Then you go with the scope and look whether and how it looks. I will show you. So colonoscopy is one of the test investigations which will lead us to look whether there is any cancer inside. Once we know that there is a cancer, then we take a biopsy, a small tissue, and that tissue is sent for histopathology, and in that, whether it comes as a pre-malignant, malignant, or whether it is a cancer. And once it is cancer, then you need to treat. So there are few tests which we used. One is colonoscopy, one is barium enema. Means you pass some dye through the rectum and look whether there is any ulcer or anything in that. We have certain tumor markers. Whenever a person suffers from a colon cancer, there is a specific marker which we call as CEA, chorioembryonic antigen. This marker should normally be less than 5, and if it is more than 5, that means you might be harboring a colon cancer. So this is one of the markers which normally for screening or in the post of follow-up we do this. One is colonoscopy or a small short sigmoidoscopy, or then we do the tumor markers. So these will help us, lead us to know. Other than that, we can get a CT scan done, that will also give us. So by these scopies or the CT or a biopsy, we come to a conclusion whether you have cancer or you don't have cancer. Based on that, we treat. So now, once the diagnosis is clear, okay, you are suffering from cancer. So, what you need to do now? What we need to do is, the tissue which was sent is proven now for cancer. We don't need to panic. Actually, I just wanted to show you the few figures how it looks on colonoscopy. If you just see this slide, you will come to know. So this is how the slides, it looks like multiple ulcers in the colon. This is probably in the ulcerative colitis and all. And if you see here, yes, this is what I wanted to show you. This is the colonoscope, what you are seeing here. This is passed through the colon, and once you pass it, you see here, this is a polyp. This polyp is attached to the mucosa, and this is how it is. This polyp may or may not be cancer, but if it is less than 1 centimeter, it needs to kept on follow-up. If it is more than 1 to 2 centimeters, it should be removed. If you see this polyp now, the next to it, okay. If you see that, this one, okay, here, this polyp has a peduncle, and this is more than a centimeter size. So this has a higher risk of turning into cancer. Later what happens, this polyp gets converted into like this. The next, the C1, where you are able to, see an ulcerated lesion, which is encircling the lumen. This is a cancer. This picture is what we normally see. Now, what happens is, once this cancer comes, cancer has a tendency to spread. Why do people die from cancer? Because the cancer, once at one place, then it sheds its cells in the lymph nodes or in the blood vessels. Once the cells are shed in the lymph nodes and in the blood vessels, the lymph and the blood is carried to all parts of the body. So the cancer from the colon goes to the liver system is gone, then it goes to the lung goes, then it goes to the bones, goes to the brain. And imagine a person whose liver has collapsed, whose kidneys are not functioning, whose lung is not functioning, ultimately what happens? Multi-organ failure, and the person dies. So these are the common site where it metastasis, it spreads. So cancer, since it spreads, we have less time. So the best thing for a cancer patient is, as soon as you come to know to a diagnosis, don't go for shortcuts. Don't go for, like someone says surgery is required, don't say no, I don't want surgery. And you go for some alternative treatment, you go for some treatment which is easier. You feel, but I should not have usually in colon cancer, most of the time you may have a stoma. Because see, this is a God-made path for the food should go from the mouth and come out from the anal canal. If there is a cancer in the anal canal or the rectum, so what? You need to remove it. And you need to make a different passage. If some doctor tells you, no, you have to have a stoma, most of the time it is temporary. But sometimes, especially if the growth is at the anal canal and the rectum lower down, where we cannot get a intestine loop and attach there, then what happens is, since the sphincter is involved, so you need to have, like most of the time they have a passage in the, in the abdominal, so that the stool should come out from there. Whenever a person is, oh no, I don't want to have a passage, and he dies within months, but never likes to have a passage in the side, and that also will go in a bag. If I am sitting here, if I have a bag, no one will come to know that I have a bag. Unless and until I open and show, see, I have a bag here. What I mean to say is, don't panic, listen, and don't go for shortcuts. Get the treatment immediate. Why? I'll show you a slide where, if you treat yourself early, you are going to save yourself. You are going to have your 100 years of life. If no, whatever life, you go for a shortcut, your life goes for a shortcut. You lose your life because the time you waste, by that time the disease spreads in the liver, lungs, and you die. So the clue in cancer is immediate treatment, early treatment, and the standard treatment. Don't go for shortcuts. And what pathology we can, when we send the tissue for biopsy, 98% of the time it is adenocarcinoma, 2% of the time it is squamous cell carcinoma, that is in the anal canal area. So these are, you see how the cancer looks like in the intestine. I am showing you the morphology. Now, see, what is important in colorectal cancer is the early the diagnosis, the better the results. Meaning to say, I told you, the cancer has some stages. When it is diagnosed, it is small, it is very early stage, then it goes into stage 1, stage 2, stage 3, stage 4. How and what is stage 1, stage 2, stage 3, stage 4? The stomach, if you see the colon lumen, if you cut it, it has a mucosa, submucosa, muscularis, serosa. Okay? If the cancer is just in the mucosa, it's very early, stage 0. There is no need to remove the whole of the colon, only just take the ulcer out. In stage 1, when it involves the mucosa and submucosa. Stage 2, when it involves the muscle layer. Stage 3, when it reaches up to the serosa. Stage 4, when it spreads to the other parts of the body. I'll show you, like for example, you see here, this figure dictates, shows you very nicely. If you see here, stage 1, see it's in the mucosa and submucosa. You see stage 2, it is in the, going up to the muscle layer. Stage 3, it is going up to the serosa. But if you say stage 4, it has penetrated, the tumor has busted out. Now stage 3 and stage 4, the disease will go into the lymphatics, it will go into the other parts and spread, and the chances of patient dying are high. But if you say stage 1 and stage 2, it is very small. So what I mean to say is the treatment at an early stage is better. Why? I will show you the results also stage wise when you treat yourself. When you do stage 1, you only remove a part of the intestine and correct it back. When it is stage 2, you need to remove the intestine and also the lymph nodes. And stage 3, you may have to even be a little more aggressive, and you may need to add chemotherapy to it. And the treatment increases, chances of survival decrease. And in stage 4, you may need to give chemotherapy and may have sometimes because of obstruction, you may do just a palliative procedure to have a bypass, at least the stool comes out. And what is the treatment, management? As I told you, surgery is the main treatment in colon cancers. if a person says surgery, be happy, because that means the disease is small. That means your disease will be cut and removed and thrown out of your body. And when the doctor says you also need chemotherapy, that means the disease, he is thinking of preventing you from the disease coming back. For that he wants to give chemotherapy. When the doctor says give just medicine, that means think that there is something very grave wrong. That means surgery cannot be performed. That means you cannot be cured. So what I mean to say is, the key is try to diagnose early, be alert and treat yourself. Don't get misled. So I told you, like in stage 1 surgery alone, in stage 2 surgery alone plus chemotherapy, in stage 3 surgery plus chemotherapy, stage 4 chemotherapy alone. Usually in cancers of the anal canal, rectum, where we are trying to preserve, there you may need to add radiation to it. So there are many different ways of treating, colon cancers. In surgery also we have open surgery, we have minimally invasive surgery. In early cases we can go for a minimally invasive surgery, but sometimes the tumor is large, it needs to be removed, and you cannot just make it disappear from the body. There has to be a cut and the tumor has to come out. So there are many different techniques based on your tumor size stage. You may go for a minimally invasive surgery, you may go for a robotic surgery, you may go for the standard surgery, that is the open surgery, and don't go for shortcuts. And always when you treat yourself, the results are better. And people always have a doubt, when should we give chemotherapy? When should, is chemotherapy required or no? Chemotherapy is required in stage 2 onwards, when the disease is, and the more the disease, the greater the stage, the more the need for chemotherapy. So what you need to do is, you need to attack the disease at an earlier stage. And chemotherapy, people have very bad myths, hairs will go, a person will not survive. Don't compare yourself to other cancer patients, because every cancer is different. The treatment is changing, the results are improving. That's why you can see millions of cancer survivors who are living a healthy and a fit life, because they have been diagnosed, treated. Cancer is not the end, it's a beginning of a new life. It's a beginning of a second life. So you have to enjoy, you have to be thankful, and you have to be happy. Cancer means not the end. So chemotherapy, whenever anyone suggests, don't think, don't get biased. Don't think chemotherapy means, now hairs are going to go. See, I always say, if 99 hairs go, 100% hairs will come back. What I mean to say is, you will grow weak. As soon as the chemo is over, you will grow fit. It is a stage to, treat. So whenever a person writes an exam, he becomes weak. Whenever this is also some sort of an examination. So you're going through it. Once it's done, once you're treated, you have the normal life. You can do everything what a normal individual does. And what are the drugs in chemotherapy we normally use? The chemo drugs normally what are used are like the capecitabine, the oxaliplatin, and irinotecan. Sometimes, these are the different types of basically a platin group is used, and the chemotherapy is normally given for 6 cycles. It is repeated most of the time once in 3 weeks. So what is the duration? I told you, may be required once in 2 weeks if you are giving a shorter dose, or if you are once in 3 weeks, and it is not for lifelong, it's for a couple of for 2 to 3 months, that is for around 6 to 8 cycles. And it has always been seen, that with chemotherapy added to it, 1 plus 1 is 2. 2 together can fight better. Surgery is done to remove or cure the disease. Chemo and all is given most of the time to allow the person to remain healthy, to avoid the disease from coming back, because these cancers, they leave their cells in the veins, that is hematogenous spread, and they will leave them cells in the lymph nodes where disease can come back. So in order, since the disease is systemic, so chemotherapy is equally required. Now, one thing, see, I believe in treating, but I believe more on prevention. How can we prevent ourselves from developing colon cancer? Number one, how can I find out whether I am suffering from colon cancer? I told you for prevention, we came to know that diet is one of the important factors. So we need to modify our diet. We know that remaining healthy, fitter, avoiding obesity. So all the factors which I discussed, try to avoid them. Try to go more for the factors, which will help you to fight against the disease, like plenty of fruits, vegetables, and all that. So what I mean to say is prevention. So now we came to know what the cancer is, how we can prevent ourselves. That is prevention. We normally call, like a vehicle is there. You take your vehicle for servicing. Your vehicle is not having any problem, but you still take it. Why? You don't want any problem to come in future. That is prevention. That is screening, we called. We have a very good screening program for colorectal cancers, especially those individuals in whose family the colon cancer runs. They need to be on a vigilant. They need to get their screening protocol in a very standard way. What we need to do is to get a colonoscopy done at least once after the age of 50 years you begin, and you do it at least once in 3 years. A colonoscopy is done, and those individuals whose family the cancer risk is there, they need to get it done more often, that is at least once in a year, and they need to begin their screening protocol a bit early, maybe at the age of 40, and if there is a FAP, a very high risk individual should begin at the age of 15 only. How? Get your colon screened, try to see whether there is any polyp. If there is any polyp, treat it. Okay, so early identification, for that the best protocol is to undergo colonoscopy or barium enema once in 5 years, or by this you will come to know, and sometimes the tumor markers, like I told you, CEA. So prevent yourself from developing cancer by adhering to the risk factors and by adhering to screening protocol. By simple, get your colon screened, serviced by a colonoscopy. That will go a step ahead to see that there is no. So I would suggest go for screening. Screening is prevention. So for prevention, get yourself screened.
With this note, thank you, sir. Thank you so very much. And Dr. Majid continuously and persistently stressed on the prevention part, and it is the doctor's call, and it is the doctor's say when a doctor himself saying that one should go for the prevention. Of course, there are cures, and there is no disease in the world which cannot be cured. This is with the cancers also. It can be cured, it can be operated, but before that, as Dr. Majid himself said, that we should lead a healthy life. We should eat properly. We should not eat and drink which is prohibited, as well as he himself said that one should go for the regular checkups, as he himself said that screening is mandatory. Don't think that you are healthy. If you go for a regular checkup, then it is good for you, it's good for your family. So dear friends, I hope that you might have liked this lecture, and if you want to give your feedback regarding this particular lecture, then you can mail us at info.cc@nic.in. and dear friends, if you have any kind of queries regarding this type of cancer or any type of cancer, then you can mail us at info.cc@nic.in. We would love to solve your queries the next time when Dr. Majid visit our studio, and we would be solving all your queries, and we believe that we would be able to answer all your questions. Dear friends, if you want to access this particular lecture, then very soon we are going to upload this lecture on YouTube, as well as if you want to access the previous lecture lectures on cancers by Dr. Majid, then those lectures are also there for you. So anytime you can access us and keep this connection with us always on, and we would be meeting again very soon and would be discussing on another kind of cancers. Till then, take care, goodbye. Thank you, sir. Thank you so very much for giving a precious time as well as precious inputs to this particular lecture. Thank you once again.
Thank you.